Hi, I'm Dr. S.K. Low, President of AAUC. Welcome to our monthly podcast series on building our collective American dream. In this June episode, we focus on our mental health and youth suicide issues and the support systems needed to build our collective American dream. Mental health is a serious problem in our community. Besides the alarming rate of suicide increase in all 10 to 24-year-old in the U.S., among Asian American, it is the second leading cause of death in our 15 to 24-year-olds. The August 2020 CDC surveys found out that 25% of the 18 to 24-year-old respondents indicated that they seriously considered suicide in the past 30 days before the survey. The devastating news of a young loved one taking his or her life touched almost everyone. There's insurmountable guilt, sadness in the survivors around the victims. To overcome this devastating challenge, we need to understand the cause and what we can do as a community to prevent the future attempts of youth suicide. Very fortunate today to have gathered a circle of experts, community leaders, and activists to discuss the subject matter and how we can provide a long-term strategy to develop support system to protect our youth from suicidal thoughts and attempts. Let's go to Diana Ding, owner of Ding Ding TV and AAUC organization member, as our host for this podcast today.
Hello everyone, I'm Diana Ding. Today we're going to talk about empowering and strengthening AAPI youth facing mental health challenges. We have four wonderful speakers. I would like to invite each to give a short introduction.
My name is Mai Uchida. I am a child psychiatrist and assistant professor of psychiatry at Harvard Medical School. I also work as a clinician and I am the director of the child depression program at Massachusetts General Hospital.
My name is Chris Norwood and I am currently the Milpitas Unified School District Board of Trustees President. The Milpitas Unified School District is 67% AAPI community with over 57 languages spoken.
Elaine.
I'm the founder of Mental Health Association for Chinese Communities.
My name is Sue. I'm the co-founder of Awakening Land and True Youth. We are a platform that enhances the mental well-being of global Asian communities. I'm the operation director of the North American Chinese Psychological Association.
Thank you. Dr. Mai, what causes AAPI community members to commit suicide, especially our younger generations?
Well, suicide sounds like a scary word. It is very common within Asian American youth, particularly girls and women between ages 15 to 24 have the second highest suicide rate among all races within the United States. The Eastern Asian culture may emphasize blame on oneself, value endurance and tolerating pain rather than taking the action. Asian Americans consistently seek mental health help at much lower rates than the rest of the population due to stigma and also just not know what's available, the stigma, worrying about what others might think if they were to seek help for their mental well-being in terms of depression or anxiety. Rates of mental health disorders are very similar among Asian Americans versus other ethnic populations. All of that is contributing to the lack of support then as a consequence of the suicide rate in Asian communities.
But do you think there's a connection between drug using and bullying in school?
Yes, there is. Any stressful event like receiving bullying or any type of a stressful event could trigger a thought of suicide or trigger a mental health condition. It's important to acknowledge that, but also important to acknowledge that not all mental illnesses are based on a certain trigger or concrete event. There are many cases where depression just happens or anxiety is just there. And a lot of these diagnoses or disorders or conditions conditions are heritable, genetic, and brain-based in terms of biological diseases. So it's not just the environment, it's not just the events, and it could just be there as a condition. When there is an environmental trigger, somebody who has these loading factors to move forward onto having a more severe condition. So I think it's important to shine light on those bullying or drug use type of events as well.
Chris, do you see that there's environmental triggers in the school?
The school is a very interesting environment that has evolved over time. It is now taking a dominant role in the household, particularly in the Asian and the immigrant communities. So schools are being looked to provide a number of different services that once upon a time the community helped to provide. A lot of kids are coming to school with things that they learned from home generationally that has an adverse effect. There's a significant correlation between bullying and some type of drug use. When we're dealing with students, sometimes we find that there are stressors at home that may be psychological, biological, or whatever else that is also engaging the child and is coming out in different ways. It is an issue that is really a top priority for educators and education systems.
This kind of mental health issues sometimes happen at school and sometimes happen at home. So what can parents, teachers, and school administrators do to decrease these health issues?
These ideas around mental health and social emotional being and those types of things, they're new because schools are primarily designed to educate. So now you have a workforce that's primarily has been focused on the education, the curriculum, the pedagogy, now asking them to dip into the psychology, the mental health, and other areas to happen in the school experience. And it's going to be extremely difficult.
There are many other organizations already working hard on these issues, like the organization Eileen has. So Eileen, what's in your mind that parents and teachers and school can do to help the mental health issues?
Important topic as the role of the family member. We must express the relationship with their children to know about their emotions.
So what public policies should be considered to address this existing mental health issue?
Public policy starts with research, and it starts with organizations like we have here that are actually doing the implementation of practices, because policy without action, without proof, and without training, without validation, nothing happens. School districts and a number of folks have great ideas or policies already on the books, but there's no one living and breathing those policies on behalf of students and equity and opportunity and social and emotional health and those types of things. When you have working organizations that are actually doing it, and when you have the research behind it, those are the things that get the assembly members, the senators, the city council members to say, hey, here's the proof and here it is in action. We should be able to follow through with a policy that's saying that everybody should be looking into this, and here's some practices out there. In some instances, policy can drive itself. So there's a lot of good things that are out there already that will come from the grassroots perspective much faster than a policy being passed and then trying to enforce a policy.
So how may the AAPI youth community address the extraordinary stress of harassment?
Actually, the Asian community has not allowed themselves to feel for a long time. We have historically represent the group that tolerates and would not raise their head when they're being scapegoated. Does it mean that we did not like being called certain names? No, we did not like this from the get-go. We just didn't say it. It's a time the Asian community have a voice and allow ourselves to be angry at the things that we should be angry about. Allowing yourself to feel that emotion and express it, that is humongous. I actually think that social media could be an advantage. It gives people a platform to express their opinions and get the feedback. It's a venue for many of the youth to express what they want to say that they couldn't say before. I think really being in tune with yourself to feel the emotions, but do not ignore the fact that you're actually quite anxious about going outside because you are afraid of being attacked, or the fact that you're quite sad and feeling lonely or isolated because of what you're seeing on the news. If it is really eating you up, that may be a sign of mental illness. If you're not happy about how you're feeling, and if you feel like that unhappiness is impacting what you can and cannot do, then that's a problem, and it's okay to get help. Just talking about it is extremely important the way that we're doing right now.
When you are talking about this, I remember that when I was a child, my mom is a very tough mom. She won't allow me to cry. Even I have tears in my eyes, and she pointed and said, "Stop your tears, stop crying." This is the part of the Asian culture. We don't show our emotions. That's part of the problem causing the suicide for some of the young kids. What are the early signs to notice to prevent suicide intentions?
We noticed that about 75% of those who die by suicide actually give warning signs beforehand. They either might talk about suicide directly, or they want to talk about death. And sometimes they even make a joke about it. That's their signal for help. Sometimes they take the steps to prepare for their death, like giving away their treasures, something they really cherish. They give it away to other people. There are usually signs of depression. Sometimes they distance themselves socially from others, even those normally are intimate with them. There might be a change in personality. Sometimes right before they decided that's it, I'm going to give up, they suddenly seem even optimistic all of a sudden. This is an attempt actually to hide what they are really thinking. It's an attempt to distance the real self from other people.
But sometimes we do see those signs from normal people. But how can we tell? Is that serious enough?
When someone talks to you about suicide, they're thinking about death, or they're thinking about killing themselves, the most important thing is to take it seriously and ask, are you thinking about killing yourself right now? If the answer is yes, the best thing you can do is to help them get professional support.
We should take seriously what they said. So what are your solutions to empower youth to face challenges and help them fulfill their American dreams?
It's important to recognize that the AAPI community is a really diverse group. Because of this, sometimes we can be divided as a group. So it's important to enhance a sense of belonging among this community and to create an open and non-judgmental environment, especially for young people to share their personal experience and to speak up and to stand out. It's important to celebrate how unique we are and to establish that sense of identity. There are research results that confirm this actually lowers the risk for suicide. We talk about American dreams, considering how diverse we are. There's endless possibilities of what we can dream of. Another way to empower youth is to provide them with high quality mental health resources. This is not just something only the government or the nonprofits can do, but also for business as well. When it comes to people at risk, there is a responsibility for businesses to help make these content and make these resources more affordable and accessible, and to adapt these resources to our cultural backgrounds in a way that makes us feel understood. This means going beyond the language interpretation services. Staffs and caregivers, professionals who serve the AAPI communities to be able to have a better understanding of the culture in which we come from, and to think about the cultural backgrounds as something that would make our experience different from somebody else's.
Chris, what's your solution to empower youth?
The information that I'm hearing now is very valuable as we look at the Milpitas Unified School District, not only as a board member who has contact with other board members, and at the state level, being able to share these insights with them as well. I will definitely be recommending this podcast for them to be able to get a better understanding of the different perspectives that you brought here today. When we think about the solutions, our number one strategic goal, build the culture of we. The culture of we is to recognize all of the different cultures, and culture is just not based on ethnicity. There are a number of different clubs that recognize each other, they recognize their differences so that they can work together. We recently adopted ethnic studies program. It's going to be rooted in the demographic of the district. We're going to make sure that our ethnic studies programs mirrors our community and empowers them and strengthens them in terms of the assets that they have as individuals, and then understanding the context of their history with other histories. So there's a lot of things that schools can do in terms of solutions. Our number one strategic goal, build the culture of we, and then allowing everyone to really understand that in the we, I'm included. Now, that doesn't mean we always get along. That doesn't mean we always agree. That doesn't mean that I have to like what you like because we're a part of the we. We're just part of the we together because we all have a common goal, and that's for us to live our best lives as our best selves.
Let everybody appreciate the difference and also embrace who they are as an individual. Sue, do you think your organization successfully tackled this major issue in our society?
Well, we approach the issue of suicide from quite a different angle. At Awakening Land and True Youth, our goal is to eliminate the stigma around mental illnesses as a whole. So by combining mental health and psychology with entertainment and arts and cultural industries and make the content entertaining, enjoyable. So things that are quite negative, and the sense of shame is preventing a lot of people from getting the help they need. We want to change that by making self-care and self-development into a really cool thing to do. And we're working with world-class psychologists and artists to develop our events and courses for the AAPI communities. We're also working with parents and families to give them the tools to respond to their children's needs in a more supportive manner. And even though we're not working directly with clinical suicide cases, but as entrepreneurs, we are undertaking the social responsibility to improve the environment around Asian Americans with suicidal thoughts. So by making it more supportive.
Dr. Mai, what you and your organization can do to help?
Be relatable to the AAPI community. Representation is huge. One of the efforts that we recently did, kind of echoing what Sue mentioned in terms of making mental health cool and fun, I released a YouTube video series interviewing a Japanese American figure skater who has gone to 2 Olympics, missed one, had experienced the depression and some suicidal thoughts, took antidepressants as well as engaged in therapy and got back on the Olympic team. I love that story because it redefined the meaning of success, which is a really important topic for Asian communities to engage in, because what family or culture or parents define as success may not be what we are looking for. Her, she feels really great right now because she engaged in mental health treatment and she is living a very stable, happy life that may not be in the spotlight as much as she used to be, but she is successful at living life right now because she's happy. Just that sense of success or failure should be in the topic of discussion. Along with mental illness or mental health, is talked about the perspective of a disorder or maybe a mental weakness is something that is bad, but you're putting an effort to be successful in terms of your mental wellness. Reframing that in a way that may sound better to the Asian might be something that we could do as well. That's an effort that I'm engaging in the depression program at MGH. There is also a program called the MGH Center for Cross-Cultural Student Emotional Wellness that is targeted for the transitional age from adolescence to adulthood, because that's when in America, many of the youth are starting to get a sense of independence and may allow to get treatment for themselves rather than relying on the older generation. What we've been seeing is that by targeting that age range to engage in this conversation and discussion, they talk with their parents, and that might bring in their parents to this type of a conversation. And we're seeing pretty good results. I am so happy to hear that there's so many other types of efforts with the same goal going on across the country. I hope that there will be more.
Thank you so much, Professor Mai. Elaine, I know that you've been working on this issue for many years, especially for Chinese American. What resources your organization can offer?
Let the people know that it whole is there. We are whole. And as our mental health association for Chinese communities, in the past 10 years, we focused 3 parts. One is the education. We had the NAMI family to family, this very useful resource for our community. And the other part is the support. And every week almost we had in Cantonese, English, and Mandarin. We provide a very strong peer support. The last one is advocacy. So I already know we always focus the policy, because this policy maker, they will make the policy will help the community, just like the Furman Assembly member can send through the bill AB 2022, and this for the school district must put professor in the high school. We will get together to reduce the stigma, to let our voice be heard.
Thanks to all our speakers and everybody who work behind the scenes.
My deep appreciation to our host Diana Ding and our outstanding guests, Dr. Mai Uchida, Chris Norwood, Elaine Pong, and Sue Cho for providing valuable insights into this serious problem of youth suicide and what our community have done and can do to prevent such occurrences. Listening to this podcast, my main takeaways are Asian American youth suicide is serious. Mental health is often overlooked and undermined as a weakness in character in the Asian culture, preventing us to seek help when it's needed. Possible factors driving youth suicide include chronic mental conditions, environmental triggers like drug use and school bullying, spotty mental health screening, and poor access and stigma related to mental health. Youth suicide is preventable. Protective factors include, within the Asian Americans, our ethnic group identity, family cohesion, and support, which our community can build upon. Multiple resources are available in the community which can provide education, support, and advocacy on preventing youth suicide. The AAUC podcast is brought to you by our active individual and organization members. For more information about AAUC and AAPI health and resources, please go to our website asamunitycoalition.org. Thank you for listening to our AAUC podcast series on mental health crisis in our Asian American youth as part of our collection on building our collective American dream. Please subscribe and comment on our podcast. Do tune in to our next podcast, which will be aired on the last Sunday, July 25th at 8 p.m. Eastern Time. The topic will be establishing racial harmony as part of our collective American dream.